Hi, my name is Jasmine Shaw, and in this presentation, I will be talking about the roles and responsibilities of the midwife. I will begin by discussing the recent changes they have gone through and the impact that these changes have made. Commenced in 2015, the National Maternity Review set out to evaluate the current standard of British maternity care so that improvements could be made in keeping with the developing times. After in-depth research that included discourse with both NHS staff and the general public, Better Births was established in 2016. The advancements it outlined were personalised care. This meant that every mother ought to receive tailor-designed care for the unique needs of herself and her family. Midwives and health professionals should develop a separate care plan with every individual woman under their care, according to her informed personal decisions and broader health requirements. This advancement also suggested that mothers be given an NHS personal maternity care budget to provide them with greater control over their care. Continuity of carer. Every mother should also be given a midwife who is an acquaintance and is from a small, community-based group. This ensures that care will be consistently built on a relationship of mutual trust and respect for all stages of a woman's journey to motherhood. According to the Cochrane Review of 2016, women who experience midwife-led continuity of carer are 16% less likely to lose their baby. Safer care. This meant constant access to the correct care, competent leadership for unexpected situations, and rapid referral caused by the teamwork of professionals. Maternity teams should carry out frequent data collections on their own performance and the performance of other teams to ensure positive development and progress. Better postnatal and perinatal mental health care. This meant more investment and money should be given to these crucial areas. Specialist care, as recommended by the Mental Health Task Force of NHS England, and access to a midwife should extend to after a woman has given birth. Longer care in designated clinics should be available as needed. Multi-professional working. This meant that midwives should work and train together with obstetricians and other professionals to create an environment of respect for other professions, while delivering the safest and highest standards of care for mothers. Working across boundaries. This meant commissioning and supporting maternity services to offer personalisation, safety, and specialist care when required. Maternity services should be provided in community hubs alongside healthcare from other agencies. Commissioners should be in charge of monitoring the quality of services so that outcomes can be improved and health inequality is reduced. A fair and adequate payment system. This meant that maternity systems should have their payment systems reformed so that providers can have adequate compensation for the extremely high standards of care they give mothers. A progress review conducted 4 years after Better Births was established observed some positive changes. There has been a 21% reduction in stillbirths from 2010 to 2018, with aims for a 50% reduction by 2025. Confidence levels in women have risen by 2.8% since 2013, and there has been a 4% rise in the number of women who thought any concerns they had regarding labour were taken seriously. 700 new specialist staff members have been recruited to national community teams, and the capacity of specialist mother and baby units has increased by 40%. There are still major areas for improvement, however. Barely 20% of women currently experience continuity of carer. Improvement to postnatal care has been slow, and the plan to embed new providers was unsuccessful. Another notable recent change is saving babies' lives. Established in 2017 and upgraded in 2019, this care bundle aims to reduce stillbirths and preterm births. It outlines the following elements of expert-developed care. Reducing smoking in pregnancy. This is to be achieved using an NIC-recommended approach, which involves providing all expectant mothers with carbon monoxide tests throughout their pregnancy, so that those who struggle with nicotine addiction or have been exposed to cigarette smoke can be identified and referred for support. Smoking during pregnancy has been closely linked with a 47% increase in stillbirths. Other issues such as miscarriage, SIDS, and low birth weight can also be caused by exposure to carbon monoxide during pregnancy. Risk assessment and surveillance for fetal growth restriction. This is meant to ensure that pregnancies involving babies who are SGA, small for gestational age, or otherwise at risk can be given the specialised monitoring required. Raising awareness of reduced fetal movement. The movements of a healthy fetus can usually be felt from between the 18th and 24th week of pregnancy. Expectant mothers should know the importance of contacting their midwife for close monitoring immediately if they notice any slowing or stopping of these movements. It has been estimated that in up to 50% of cases, episodes of reduced fetal movement lead to stillbirth within a week. Effective fetal monitoring during labour. All women who work in labour wards should be able to effectively interpret cardiotographs during high-risk births and use the buddy system in the event of complications. Reducing preterm birth was added as a fifth element in 2019 after the publication of the Safer Maternity Care paper. The Saving Babies' Lives Care Bundle was evaluated by the University of Manchester, who reported some positive changes. It is uncertain that these changes can be attributed entirely to the care bundle, and there is still plenty of room for improvement. However, the university was able to report a 20% reduction in stillbirths and a 59% increase in the detection of babies who were small for their gestational age. They also found that infants were monitored more often, and mothers were more aware of their baby's fetal movements. I will now discuss the role and duties of the midwife in providing for the physical, social, and psychological needs of a pregnant woman and her baby during the stages of development. Pregnancy is a time filled with extreme challenges and stress for all women, but some go through it while facing additional struggles such as financial difficulty, physical disabilities, domestic abuse, addiction, mental health issues, and major life changes. Midwives must be able to offer professional, judgment-free support in these areas. Antenatal care. During the antenatal period, a midwife performs screening and risk assessment to help mothers formulate the care and birth plan that best suits their needs, and to identify any complications with the baby, such as Down syndrome, sickle cell, and HIV. Mothers who are over the age of 40 are at particularly high risk for these abnormalities, while mothers under the age of 15 are 5 times more likely to die during pregnancy, according to a study by Save the Children in 2012. Pregnancies of women with a high BMI are also high risk, as they carry a greater chance of miscarriage, gestational diabetes, preeclampsia, and blood clots. All these women should be given risk assessment using the Antenatal Assessment Tool, as recommended by NICE, the National Institute for Health and Care Excellence. Antenatal assessment is also for the following groups of women: those who have previously experienced a difficult pregnancy, those who have a history of certain conditions, and those with a family history of certain conditions. Intrapartum care. The intrapartum period might arguably be where midwives play their most vital role, as it is the most dangerous and physically demanding time for new mothers. This is a major reason why continuity of care is so important, as it gives women a dedicated support system and helps them to feel safe during an experience that will almost certainly be extremely traumatic. The midwife and mother will have formulated a birth plan together during the antenatal stage, with the midwife offering help and advice on crucial factors such as where the birth will take place, who will be present at the birth, what methods of medical intervention and pain relief the mother will receive. Not all women will opt to write a formal birth plan, and some births will not end up working out as wanted. However, a birth plan encourages communication, giving mothers the opportunity to have questions answered, and also helps the midwife to get to know the mother better. Antenatal classes. Weekly antenatal classes are another fantastic way for midwives to give support, information, and advice. They are provided free by the NHS and are also a good opportunity for parents to build friendships, both with their midwives and with other parents. A study conducted in 2019 found that women who received antenatal education had lower rates of birth fear, depression, anxiety, and stress. Some topics covered in antenatal classes include how to feed and care for a newborn, how to maintain good health through pregnancy and after the birth, relaxation techniques, how to make a birth plan, what happens during labour, and how to cope. Pain relief. It is important for a mother to know and choose her preferred methods of pain relief from the options available to her before the birth. This makes it easier for her to remain calm, leading to an easier birth. During antenatal classes, midwives will show women how to use relaxation and deep breaths to help manage their labour. Some other commonly used methods of pain relief include the following. Entonox. Entonox is a mixture of oxygen and nitrous oxide gas that is very commonly used during labour. The mother breathes it in through a mask as each contraction begins. Epidural. Women who are giving birth in labour wards may be given an epidural. This is an injection of local anaesthetic into the spinal nerves of the lower back. An epidural effectively blocks labour pains while still allowing the mother to move and push, but it may extend the second stage of labour and lead to a greater chance of assisted birth. Pethidine. This is a pain-relieving medication that is injected into the mother's thigh or buttock. It is not generally used after the first stage of labour, as the effects only last between 2 and 4 hours. TENS machines. TENS stands for transcutaneous electrical nerve stimulation. TENS machines may be supplied by the hospital or hired by the mother. Evidence suggests that TENS machines are most helpful in the early stages of labour. They are thought to work by stimulating the body to produce more endorphins, which are a natural painkiller. Postnatal care. The postnatal stage lasts for up to 6 weeks after the birth. The midwife will conduct regular checkups during this time to ensure that both the mother and baby are thriving and refer them to a relevant specialist if required. Mothers will be monitored for complications such as infection, abnormal bleeding, pain, irregular bowel movements, anemia, and mental health issues. Babies will be monitored for abnormalities in breathing, heart rate, bowel movements, feeding, and weight. Up to 10% of a newborn's weight is fluid, and it is normal for them to lose this water weight soon after birth. This is only a cause for concern if the weight is not gained back within 2 weeks. It is important to remember that the immense joy and excitement brought on by the birth of a child are accompanied by exhausting physical and hormonal changes. Newborns will also disrupt the family schedule in drastic ways, as they are extremely demanding and require constant attention. Many new mothers feel confused, stressed, and overwhelmed, with an average of 50% experiencing some level of postpartum depression. This is why a healthy lifestyle with a nutritious diet, plenty of exercise, and a good sleep schedule are particularly important during early motherhood days. Unfortunately, this is also the time when those areas are often neglected and difficult to maintain. Midwives will give women advice on how to take care of themselves during the postnatal stage through things like gentle exercises, strong social support groups, and plenty of rest. Around 2 weeks after the birth, the midwife should check in with the new mother to ensure she is not showing signs of postnatal depression. The role of the NMC. The Nursing and Midwifery Council, or NMC for short, was established in 2002 and helps to keep the public safe through 3 main responsibilities. They keep a register of all midwives who are eligible to work in the UK, push for midwives to receive a high standard of education, and investigate any concerns regarding a midwife's capability to practice. Over 40,000 midwives are registered with the NMC, and they are required to complete a revalidation process every 3 years to ensure that their performance and code are up to the highest standard. Midwives who are deemed unfit for practice or whose expertise is not up to date may be removed from the NMC's register temporarily or permanently. It is a criminal offence for anyone who is not registered with the NMC to practice as a nurse or midwife. Midwifery is a very demanding field of work, and midwives are expected to be highly educated, not just on childbirth, but also on a variety of other areas, such as how to establish a secure and trusting relationship with mothers through excellent communication skills coupled with kindness and compassion, what actions to take in the event of an emergency during labour, and how to help ensure that mothers remain both physically and mentally healthy after the birth, how to give advice on breastfeeding, breathing exercises for the baby, and other aspects of newborn care. Midwives also have a duty to empower women by standing up for their rights and being respectful to their views, preferences, and decisions. Implications of the Code. The Code has been in effect since 2015 and lists the following 4 elements that explain how midwives are required to conduct themselves. Prioritise people. This means acting in the best interests of women and striving to meet their physical, social, and psychological needs. Each mother is an individual with unique wishes and needs, which the midwife must listen to and respect. Practice effectively. This means striving to improve the practice by respectfully listening to the advice of other midwives and sharing your own. Midwives must communicate clearly and effectively, and they must take notes on any complications they encounter for other professionals to review. Preserve safety. This means being attentive to the signs of both physical and mental illnesses. Midwives must know how to give information and advice on the care, medicine, and other treatment options that are available to each patient. They must also be frank and open about any mistakes they make or concerns they might have. Promote professionalism and trust. This means upholding the reputation of midwifery by constantly acting with integrity and refusing to discriminate women based on any and all grounds. Midwives must adhere to the laws of their country and always maintain clear professional boundaries with their patients. Communication in healthcare settings. Midwifery is a business that typically involves multidisciplinary teams. This means workers from a variety of different companies will work together sharing common objectives and collectively making decisions regarding the treatment of patients. Effective communication is therefore a vital part of a midwife's job, as it goes a long way towards preventing mistakes and building a team that thrives whilst providing the highest quality care. The effectiveness of a multidisciplinary approach. There are a few challenges that can arise from working as part of a multidisciplinary team, MDT. The diversity of an MDT means that the goals, values, and priorities of its members may sometimes clash in a detrimental way. This highlights the need for clear and effective communication. Furthermore, it can take time for the members of an MDT to learn how to work off each other's strengths and weaknesses and establish their own role in the team, thereby functioning as a highly competent unit. This means that the full benefits of working in an MDT are often not immediately realized, leading to many projects being abandoned. Multidisciplinary teams require large amounts of funding, which puts pressure on the NHS, and the distribution of the workload in this kind of team may be uneven or inefficiently divided based on the experience of each member. Despite these challenges, MDTs are effective tools that come with many benefits. Working together and sharing responsibilities means less burnout and higher rates of job satisfaction, leading to higher standards of care. A multidisciplinary team offers access to a massive source of expertise, improving the accuracy of diagnosis and quality of treatment for all patients, which is particularly vital for those with more complex conditions. MDTs are particularly helpful for those with multiple health complications, as the team members will work together and listen to each other's suggestions to put together a cohesive, effective treatment plan. In this way, MDTs promote collaboration and comprehensive care.